As we prepare to reach the peak of COVID infections, the numbers show the situation is more dire in Fairfield County, which is, of course, closer to New York City, the epicenter of this pandemic. Dr. Daniel Gottschall is the Vice President of Medical Affairs at St. Vincent's Medical Center. Doctor, thank you for being with us.
Thank you for having me.
Is your hospital overwhelmed right now?
No, we're not overwhelmed. We're busy. We have lots of patients. Probably about almost 70% of the patients that we have in the hospital are either known to be positive with the COVID infection or what we call people under investigation that we're awaiting the results to come back.
So can you talk about the efforts then to protect the staff and the news we keep hearing about the shortages of PPE?
You know, we're pretty lucky. St. Vincent's is part of Hartford Healthcare. We anticipated this. The most important thing, obviously, is to maintain the safety of our staff, the rest of our associates, whether they're the doctors or the people that are keeping the rooms clean. We have plenty of personal protective devices. We don't have a shortage of our N95 respirator masks that have been in the news. We have plenty of face shields, gloves, gowns. We're okay for the time being.
That is good news. How are your staff doing? I imagine, though, there is a lot of grief from seeing patients dying in this way, sometimes alone.
You know, the staff here is really, it's something to behold. I mean, their strength, their will. You know, St. Vincent's has been about a hospital that's been in Connecticut for well over 100 years. We're a mission-based organization with our goal of providing the highest quality, highest touch care to our patients and being mission-driven, special attention to the poor and vulnerable. They live this every day, but they are leaning into this. Their morale is truly outstanding.
And I imagine it helps the morale. How has the community supported the hospital? And are you seeing a lot of donations?
The support of the community also, from people making masks to dropping off food. We've had everything from the Girl Scout bringing us cookies to Trader Joe's, bringing food and lunches and even flowers to pick up the staff. We've had the universities around Quinnipiac and Bridgeport donate beds, and they have their anesthesia machines for training that they're donating. It's been a true community effort. Today at 2:30, our Bridgeport first responders are coming to celebrate with us. They're bringing their fire trucks and the police trucks, ambulances, really to show a big show of support. So if there's anybody around 2:30, we're really pretty excited to have and see that support. It really lifts everybody's spirits.
And that is so nice. And I know people want to help you guys. So it's wonderful to see that it matters and that it's lifting spirits there. Is there anything that, any requests? If people want to help you, what would be a request that they could fulfill?
I think the biggest request is to stay home, to wash your hands, to social distance, to stay safe. Sure, we love the support, but the best support we can have from our community is that you don't need our help, that you do everything you can to protect yourselves and your family from this very infectious disease.
We've recently had the orders from the CDC change about wearing masks in public. New Haven has now made it a requirement. Can you elaborate on the importance of that and what you're telling your patients?
Yeah, I think there's been a lot of confusion because the data continues to change. But what we're finding now is that wearing a mask really is a good public service to your neighbor. Originally, we thought that wearing a mask protects you, and it does offer you some protection, but really what it does is it protects the people that are surrounded by you. We're finding that a lot of people are asymptomatically shedding the virus, may not even know that they have it. So if you wear a mask and you happen to be one of those people, you're actually protecting the people that are around you. So it's very important, and we're asking every patient when they come into the hospital to bring their own masks because they're protected. All the doctors, every staff member as part of Hartford Healthcare is wearing a mask. Takes a little while to get used to see everyone walking around the hallways wearing a mask, but it's just good for the community.
And when people are concerned that they can't get a mask, would you say it's okay for them to just put a scarf around their face or some sort of barrier?
Yes, that's been shown. We want to decrease how much of the virus is being spread. It's spread, theoretically, it's spread by coughing and sneezing. So if you could keep that amount of stuff inside and not getting out into the environment, that does help. So anything they can do. And we're seeing lots of people being very creative and good for them.
The number one question we get on Facebook all the time is, when will all of this be over? I know that's a crystal ball question. Nobody really knows. But as you prepare there, do you think the projection has been for Hartford Healthcare of reaching the peak sometime the end of April, early May? Does that seem on track for you? And are you preparing for the surge?
We're prepared every single day. We've been preparing for the last month. We're preparing for the surge, whether it's on our facility side, making sure we have enough beds, we have enough ventilators, making sure we have enough protective equipment. And then, of course, staffing. We want to keep our staff safe. We need them to be healthy so they can take care of patients. So we're meeting several times a day, probably 7-8 times a day, talking about every last detail, looking at every nook and cranny throughout the organization to make sure we can care for the community.
And lastly, there's a lot of talk about reopening the economy. Do you think reopening the economy is the right move anytime soon?
I'm a doctor. I'm not necessarily qualified to answer that question. All I want to make sure is that we keep people from coming into the hospital and being sick. And if the experts think that keeping people social distancing, making sure that they're not out in the community every day like we used to be, then that's the most important thing to the people that are in this hospital every day.
Thank you for your time and your insight, doctor. We wish you all well.
Stay safe. Thank you so much.
Thank you.